In dark blue there, with the dark hair.
Yeah, this seems to, the Conservative philosophy seems to work on the idea that of a very old-fashioned idea of sort of a family doctor. It's all very rosy. But I wonder how many members of the Conservative and the coalition government actually use the NHS in the same way that we do, or whether they just go to their GP and then hop off to a private hospital once the treatment starts.
Well, you'd have to ask every member of the Conservative Party what they do.
Do you use private healthcare?
NHS, yes.
Do you use private healthcare as well?
I have used private healthcare.
Why?
And I use the NHS.
Why? Why did you feel you had to use private healthcare?
I didn't feel I had to use private healthcare. I chose to.
Because you can afford to.
That doesn't make sense. You made a choice.
In the country cannot afford to.
But actually,
why did you make that choice?
The overwhelming amount of healthcare that my family have is NHS. We're all dependent on the NHS. I just as much as anyone else.
The man in the grey shirt up there. You, sir.
Am I alone in feeling slightly cheated by the fact that the biggest reforms to the NHS in its history are coming right after an election when they didn't appear in anyone's manifesto?
Absolutely. You're right. Yes,
you're right. George Galloway.
A brilliant point, I may say, from the young man in the audience. The mask is slipping, and we're seeing it here tonight. Sally's wrong. They're not doing this for the hell of it. They're doing it so they can hand over vast amounts of public money, which they've ring-fenced, to their rich friends in the private healthcare provider sector. That's exactly what they're doing. Andy quoted a private provider earlier from the aptly named tribal healthcare provider. That's what they're called, tribal. They said that they're looking forward to these proposals which mean the denationalisation of the National Health Service. And Dr. David Price in Edinburgh University said it well today, I think in the Times. He said that the bottom line here is this means the abolition of the National Health Service. It will be a brand and nothing more by the end of this 5 years. These private providers, like that one that employed a doctor who through the criminal misprescription of drugs killed that unfortunate David Gray. Do you know what they were called? Take Care Now. Well, take care now, everyone watching this. The Tories are abolishing the National Health Service if we let them get away with it.
The man in the second row, the man in the second row there.